some books on a couple of the vacant seats up here in case you want to grab one. Maybe neighbors can pass them back or something, because I don't think the book's made all the way back. Thank you so much for having me. Thank you so much for being here. I'm really happy to have this chance to talk about this issue, and I appreciate that the wall is color-coded to match the books. That's a nice touch. That's unexpected. But I want to first by giving start by first giving a little bit of an orientation to who I work for. So National Housing Trust is a national nonprofit. We're a nonprofit affordable housing developer in the DC area largely. And we work at the intersection of climate, resilience, affordable housing, and equity. So while I spend my days thinking about how to make affordable housing more climate resilient, this talk is really about broadening that lens to look holistically at the climate risks that we all face. We're here today to focus on two concurrent and mutually impactful trends, both of which are directly relevant to the tasks before you as a community as you look to refresh your comprehensive plan and think about your recommitment to being an age-friendly community. We are here to discuss the aging of our population and our changing climate, both of which have the potential to really radically disrupt how we plan for our communities, but they differ in the degree to which their changes are evident. For most people, but still not all, there is little doubt anymore that climate change is here, it's real, and it's impacting our daily lives. In the US and across the world, people now endure summers that are characterized by code red air quality days and winters by either too much or too little snowpack. Extreme heat and cold are becoming more common throughout the US and across the world. Hurricanes are increasingly frequent, intense, and deadly. Extreme rainfall and wildfire smoke plague parts of the country that are unaccustomed to such conditions. We see clear evidence of the impacts of climate change in the destruction that it leaves behind. Here in the US, the National Oceanic and Atmospheric Administration, NOAA, tracks disasters, nearly all of which are climate fueled, that result in at least $1 billion of damage. The number of these billion-dollar disasters has increased each year. Since NOAA started tracking in 1980, the yearly average had been 8 such events per year. In 2022, there were 18, and in 23, there was a record high of 28. These disasters include the full array of wildfires, storms, flooding, hurricanes, cold waves, and droughts, and reach nearly all corners of our country. Time and time again, we see that events of this scale lead to the loss of life and the devastation of homes and communities that will in many cases take years to recover from. This climate trend intersects with and compounds another one that is less talked about and maybe less apparent, but which will nevertheless have a tremendous impact on our communities. We are, as a country, becoming older. People over 65 are the fastest growing demographic. This is our first year of what is called peak 65, with 4 million people turning 65 every year now through 2027. 100 years ago, 1 in 20 people was over 65. Today, roughly 1 in 6 is. Moreover, by 2034, there will be more people over 65 than under 18 for the first time ever in the United States. And that group will be increasingly diverse, with far higher growth rates of older adults among Black, Asian, and Latino populations than among whites. In 2020, the share of people of color within the older adult cohort was just 24%. By 2040, that will increase to 34%. And while East Lansing may still be characterized by a large youth and student population, the needs of older adults are certain to increase as that age cohort grows in size. Altogether, these demographic changes represent a significant tipping point among a sizable share of our population, and yet it's a topic that rarely gets media coverage or discussion that it deserves. As a result, many community leaders and advocates are left with a poor understanding of what this shift means and what older adults' needs are. Part of the reason we have a poor understanding of aging is that we lack a standard definition of who even is an older adult. Since we're in a place of learning, I thought it would be appropriate to have some quizzes. I wasn't joking about that. I said there were going to be quizzes. So feel free to shout out here. I referenced the number 65, but according to government policy, at what age does one start to be classified as an older adult?
50. 60.
Oh wait, hold on. 50, 60,
55.
55.
Yeah, 55.
Okay. Is that consensus? Can we agree on that? More or less? Okay, it's kind of a trick question. There is none. There is no standard definition of what it means to be an older adult. Protection from age discrimination at work begins at age 40.
Huh.
I know, right? You get your membership packet from AARP at age 50. They find you no matter where you are. You qualify for retirement communities at 55. You start getting movie discounts at 60. You can start collecting Social Security at 62. Qualify for Medicare at 65, and so on. Our poor understanding is exacerbated by the fact that we live in a youth-obsessed culture where any mention of aging is usually accompanied by the word anti in front of it. Aging is something to be vigorously fought, not celebrated or even planned for. Our poor understanding of age is also complicated by the fact that older adults continue to break the mold and shatter images of what it means to age. We see people running marathons in their late 80s. Recently, a 90-year-old man became the oldest person ever to travel into space. Older adults continue to defy expectations and stretch the boundaries of what it means to age. But there are some inherent truths to aging when you look across the cohort that I believe are poorly understood among the general population, and therefore among leaders. 1 in 6 of older adults live near or below the poverty line. 98% live independently outside of congregate facilities. Nearly 30% of those live alone. 1 in 5 don't drive. A third have unmet travel needs. 1 in 9 live with Alzheimer's, another form of dementia. 40% have ambulatory limitations, and 80% live with 2 or more chronic medical conditions.
What age are you doing for these
It's
stats?
a mix. Generally it's 65, sometimes 62, depending on the data source. It's a shortfall for all of us when we acknowledge these realities, when we fail to acknowledge these realities, and let them guide our work. So we have these 2 massive trends underway, each of which has its own set of institutions that work to address them. Engineers, data analysts, chief resilience officers, emergency managers are working diligently to plan for the effects of climate change. Meanwhile, gerontologists, healthcare professionals, and aging advocates are planning for an older, grayer future. That division of labor is often mirrored in local, state, and federal agencies that are similarly siloed. One set to oversee public works, regulate utilities, and manage emergency response, and a different set altogether charged to promote health and support healthy aging. Therein lies the rub. We have these 2 or more siloed approaches that are responsible for each tackling complex problems without a full understanding of how they connect. There is simply too little attention paid to the intersection between them, not enough focus on how and where climate change exacerbates risk for older adults, and a lack of urgency to take action in communities that are home to an increasingly large share of them. And this matters because you here at East Lansing are at some key inflection points where you have the chance to craft planning documents that better bridge that gap. Tools like the new Comprehensive Plan, the Climate Sustainability Plan, and the next 5-year age-friendly action plan that East Lansing will be soon starting are all critical opportunities to plan for this intersection because of how much they will drive future decisions in policy, programs, and spending. It's absolutely essential that the needs of older adults are better considered in these documents because we already see what happens when we don't adequately plan for their needs. I'll attribute that failure to the blind spots that many of us have as planners, as advocates, as community leaders about the needs of older adults, resulting from some of the dynamics I described before. These blind fests manifest in communities that are built without any or any transportation alternatives for non-drivers, as well as manifest in a lack of adequate seating or shading for public transit users. They're evident in parks and public spaces that are designed without adequate seating or restrooms. They're also revealed in our lack of housing that is designed for accessibility and affordability in order to serve people with disabilities or account for changing needs. These are precisely the sort of realities that drive the work of age-friendly communities, like East Lansing, around the country, who are motivated to help create places where people of all ages can thrive. They do so because they listen to their older adults who overwhelmingly, almost 2/3 as the case here in East Lansing, say they want to age in their home and in their community. Because when you look as a whole, communities fail to account for the older adults' needs. those are not places where people can thrive and age well as they grow older. Moreover, all of these challenges that I just described are amplified by climate change. But perhaps nowhere are the blind spots that we all have as planners and as advocates more evident and more dire than when you think about the effects of climate change and climate-fueled disasters. Among the largest named disasters, we see time and time again that older adults bear the brunt. Hurricane Katrina, Sandy, California campfires, heat domes that covered the Pacific Northwest, winter storms in Buffalo, New York, Hurricane Ian, and more recently the Lahaina wildfires, and even this summer's Hurricane Beryl, and many more. For more than 2 decades, hurricanes, winter storms, wildfires, and extreme temperatures claim a far greater share of older adults' lives relative to the fact that they represent about 20% of the population. Older adults die at double, triple, or quadruple the rate as people who are younger. This trend, and the fact that it remains virtually unchanged for 20 years, makes it painfully clear that we are failing to create communities that safeguard older adults in their times of greatest need. It's not like we haven't been told this was happening. News stories almost consistently reporting on the tragedies. It's heartbreaking to see the magnitude of those failures. But paradoxically, it's also sometimes easy to overlook the human scale of the devastation. Oftentimes, when the statistics that I shared appear in the news, they are a single line buried deep in a news article. Other times, albeit too rarely, those stories come through and they come to light through reporting in the news that really truly seeks to understand the experience of older adults who wrestle with these climate-fueled disasters. One such story was published by the Washington Post last year, which explained what the Lahaina wildfires meant for the 100+ people who died. This particular story painted a picture of what the fire meant for residents of a senior housing complex, comprised of about 35 units, which was designed to provide safe, affordable, independent, and accessible living for Hawaiian elders. The development itself was designed as one-level apartments, navigable for people who used walkers or wheelchairs. It fostered a sense of community among the residents, at least one of whom had been previously unhoused before securing a spot in the project. The development, a Section 202 HUD subsidized property, was designed to enable people to live independently for as long as possible. But it's also important to describe what it wasn't. It was not a facility that bore any responsibility for notifying or transporting residents out of harm's way, many of whom no longer drove and relied on friends or families for mobility. It was not a facility that was designed to ensure that people could access help when they needed it. It was designed for people to be independent. Many staff did a cursory notification and then left as the flames approached. So when alarms went off belatedly to notify residents about the impending fires, many scrambled to get rides to leave. Some set out on foot, unable to get far. Others were reluctant to leave because they had no place to go, or they had pets or in-home medical equipment that they relied upon. All of these conditions contributed to the ultimate death rate, in which 73% of the people who died were over 60, including Miss Louise, who's pictured here, who was 98 but had lived independently in the complex for nearly a decade. It's hard to ignore these tragedies, and yet it's also difficult to mobilize action to solve them. Likely due to the repetitive nature of these disasters, there has begun to be some focus within the aging world about the risks that climate change poses for older adults. In June 2021, AARP dedicated its member-facing bulletin to the topic of climate change. That gave rise to another AARP publication that was geared more towards local leaders that I helped to shepherd when I was there, which is called the Disaster Resilience Toolkit, which we co-branded with FEMA. But I will flag that AARP's most recent policy release, which deals on the topic of aging well, which is a new policy guidance related to statewide master plans, entirely ignores climate risk as a factor that impacts people's ability to age in place. In summer 2022, the American Society on Aging focused its Generations Journal on the climate crisis and added fighting climate change as one of 4 policy priorities. And earlier this year, the Gerontological Society of America released a special issue of their publication, The Gerontologist, focused on climate change with several peer-reviewed in-depth articles and pieces looking at how age-friendly plans can better account for climate. So we're having some mixed experience in the aging world in terms of embracing climate change as an issue that matters to older adults. The changes also slow to come in how our emergency response and climate resilience planning system considers aging. So it's quiz time again. This time it's a double header. Which federal agency is responsible for disaster recovery?
FEMA.
Okay. And when did that agency begin to start including age or aging as a required vulnerability to consider in its planning documents?
It hasn't.
You're on to me.
What was that answer?
No.
There is none. They don't yet.
They don't.
But on the first question, you get partial credit. Yes, FEMA is responsible, big player, but so too is HUD, which plays a really significant role in supporting communities to invest in resilient disaster recovery. And as we discussed the second question, the answer is not yet. They don't. These agencies do not explicitly require that age be considered. Neither has as yet required that age or aging is part of grantee plans that need to be developed that ultimately dictate the use of funds. So let's start with FEMA. We're gonna go a little policy nerdy here for a minute. One of the significant tools that FEMA uses to help communities and states assess their risk before a disaster and develop a plan to mitigate that risk is something called the State Hazard Mitigation Plan, which all states have to complete in order to be eligible for FEMA programs. There's only a nominal focus placed on integrating socioeconomic factors and demographic factors into the analysis. And it falls short of asking planners to consider age and the share of older adults in a community as part of that analysis. There's no mention in the updated version from 2022 of the need to engage aging services or disability services as part of the required stakeholders when communities are developing that plan. Therefore, it's possible to be fully compliant with the updated FEMA guidance without ever asking and answering the questions: how is our population changing? What is the share of older adults in our community, and what is that trajectory? What are their needs in the face of changing climate risks? Now let's turn to HUD. HUD also plays a critical role as the administrator of billions of dollars of community development block grant funds, which I'll abbreviate as CDBG. These are both general funds that are incredibly flexible for communities, and there's a special flavor of them that is allocated for disaster recovery, which is called CDBG-DR. I'm a HUD alumna and a huge fan of the important and innovative work that HUD does, but it's still important, nevertheless, to call out the shortcomings to help explain the challenge that we face. The consolidated plan document that you all are now refreshing is the document for communities to articulate how you will spend your CDBG and your CDBG-DR dollars. Yet it is entirely possible for a community like yours to develop a compliant plan without considering older adults' needs explicitly. That's because HUD's charge is to serve low and moderate income households and address, quote, unmet recovery needs as part of their disaster recovery. It indicates the need for grant recipients to serve vulnerable populations, but doesn't define them exactly. Moreover, when HUD identifies critical partners and data tools that grantees should use to create their consolidated plan, it completely overlooks the role of federal, state, and local agencies that are responsible for delivering aging services. That lack of consideration for aging concerns in these two federal agencies is problematic, and it's indicative of that siloed approach that I spoke of before. The result of that oversight is that for the most part, our current national approach to risk mitigation and climate resilience doesn't account for the unique challenges of adaptation that older adults may experience. It leaves too many people falling through the cracks and underserved or wholly unserved, and it fails to acknowledge that age can be a risk magnifier for many people, overlaying other challenges associated with income, health inequities, or lack of access to people and services. Let me give you a few examples of what I mean by this. So I want to start by painting a picture of what I mean when I say that older adults face challenges to adapt, and also how older adults are left unserved or underserved. The two examples that I'll share aren't universal, but they are indicative of the realities of our current approach. First, after presenting to another audience in upstate New York late last year, I was approached by an older woman who had listened to my talk and came up to share her story. She lived in her home of many decades and had planned to remain there as she aged. But the new flood maps for her town of Ithaca had been released, and she now found herself in floodplain. This wasn't the result of any particular disaster. It was in response to FEMA updating their maps with new data to better reflect future risks. As a result, FEMA was now requiring her to elevate her home, which she seemed unwilling to even undertake because of how difficult it would be. Alternative, she was told she could get flood insurance to the tune of thousands of dollars per year, which she said she couldn't easily afford on her fixed income. She frankly found the whole experience with FEMA to be stressful and overwhelming, and this was a comparatively good situation wherein she still had a secure home to live in. As a result, she planned to sell her home. A neighbor was scooping up homes as they went on sale, and she seemed relieved to at least have that option. But this whole arena of elevating or rebuilding after disaster or investing in resilience to make one's home safer is an area that is ripe for fraud and abuse of older adults, particularly when faced with a high-pressure situation like this woman's. The second story I'll share represents another facet of this dynamic in which people are left unserved. It's a situation that is sadly becoming increasingly common, where extreme weather and rainfall results in damages to homes that don't rise to the level of a full-throated FEMA response and wouldn't show up on that billion-dollar map that I shared earlier. I was approached about a December 2023 disaster in Ventura County, California, where an atmospheric river damaged almost 500 homes, largely occupied by low-income families, undocumented people, and older adults. 3 inches of rain dropped in 45 minutes, causing widespread flooding and damage to homes, making them uninhabitable and dangerous. No one had flood insurance because they weren't a floodplain. This was a freak event intensified by climate change, and the damages were not covered by homeowners insurance. Many also lacked adequate auto insurance that would cover the cost of replacing their cars that were totaled because they became inundated with water. The costs to repair the damage in just the homes started at $30,000 because residents had to remediate the asbestos that was already in many of these older homes. But the costs were far higher because flooring, doors, walls, electrical systems, and appliances would all need to be replaced as well. One might presume that since this is a clear disaster by conventional definition, FEMA relief would be available to rebuild. But unfortunately, the event was too small to trigger FEMA relief, which has a threshold for 1,200 units to be damaged in order for relief programs to flow. The city and the county and philanthropy stepped in to try and provide support, ultimately raising more than $500,000, about $1,000 per household. But the only pre-existing federal program that was made available to these folks was Small Business Administration loans. And many older adults who needed the help couldn't access that capital to rebuild because they lived on fixed incomes that didn't include the capacity to take on a new loan. While others feared that the loan would cause them to lose their house entirely if they defaulted on the loan and couldn't repay it. The Lahaina, Ithaca, and Ventura examples that I talked about may seem isolated, but they aren't. Similar experiences can be found in the response to Hurricane Beryl in Texas in recent weeks, where extended power outages have led to the deaths of more than 36 people, of whom 3/4 were older adults. And an NPR story earlier this month explained how heat is impacting older residents in Montana, where 1/4 of the population is already over 60. There, a recent study demonstrated that a 1% jump in Celsius temperature average resulted in a 1% increase in 911 calls, most of which were made by older adults who need help. That may seem small, but when you think about the fact that temperatures can grow to 5 or 10 degrees above normal, that can mean hundreds more emergency calls spread across a rural, scattered landscape that needed to be supported and responded to by an already stretched thin public safety team. I don't think that anybody would dispute that navigating federal programs is a complex challenge. Many individuals, including but not limited to older adults, are overwhelmed by these conditions and would be overwhelmed by these conditions and need help. For older adults who live in the community outside of congregate facilities, the challenges of navigating evacuation or dealing with new flood map requirements or rebuilding a home without federal assistance are left to the individual to solve. This is a natural role for community-based organizations, but they too are often overwhelmed in the face of disasters and frankly not equipped to provide the kind of support at the scale that is needed. That was certainly the case in Lahaina and Ventura County and Ithaca. All of this would suggest then that people who live in congregate facilities may be better supported. After all, theoretically, there would be more support there to navigate climate risks for those who live in a facility that is charged to provide for the needs of older adults. Assuming that's the case, how many older adults would this affect? What % of older adults live in congregate facilities like assisted living or nursing homes?
Less than 5%.
Okay.
2%.
Ooh, someone paying attention to math before. Good. Yes, that is exactly right. 2%. Most audiences who are paying attention say like 40%, 20%. People have a vastly representation of how many people live in nursing homes. But it's true, only 2% of older adults live in congregate facilities. The vast majority of older adults live in the community.
Does that include assisted living as well
The
as
2%
nursing
does.
homes?
Yeah, yep. The fact that so many people live independently, and of those who do live independently, 30% of those individuals live alone, begs the question of support. What support can older adults count on in terms of helping them relocating or repairing flood or storm damage or elevating a home? Certainly some have the support of families or children nearby, particularly if they come from racial or ethnic groups with a tradition of multi-generational living or family-based care for the elderly, but that isn't the case for all. Moreover, increasingly older adults are childless, whereas 11% of people over 75 have no kids, 20% of younger older adults do not, age 55 to 64. So again, theoretically people living in congregate facilities have more support. That's definitely the care for those who live in facilities that provide responsible, safe, affordable care for older adults that enhance their quality of life. Surely those individuals have the support they need to adapt and respond to climate change, right? In the best of situations, yes. Yeah.
Would you count, let's say, fairly tight condo settings as congregate?
I would not. No, because those are individually
I
owned.
didn't think you would,
It's kind of like the Lahaina
I
example.
have friends who live in condos who really have a support network.
I'm going to get to that. Excellent point, and that's exactly the kind of housing solution that we need to create more of. But there's no responsibility at the sort of institutional level to make sure that those people are cared for, which is part of the reason that the Lahaina disaster was so tragic. Many congregate facilities do have robust, tested, and effective means to protect their residents from climate change, from climate risks, but not all do, obviously. You may be haunted, like I am, by some of the pictures that came out of Hurricane Katrina of wheelchair-bound older adults submerged in water in nursing homes. Since that time, there have been efforts at the federal level to ensure that facilities better serve residents and are held accountable when they don't. Largely, that takes the form of a 2016 federal policy called the Emergency Preparedness Rule that requires any institution funded by Medicare or Medicaid prepare for disasters. But it too has its limitations. First, it doesn't apply to senior housing complexes like the one that this gentleman just raised, or the one I described earlier in Hawaii, because those are not funded by Medicare or Medicaid. Those and thousands of other HUD-funded Section 202 units or market rate condo association type projects like the ones that were just mentioned do not include any provision of federal health care and therefore wouldn't be covered by this rule. Second, efforts to roll back the requirements of the rule during the prior administration led to a patchwork across states in how it's implemented. As a result, some states more stringently enforce the policy, and other states take a more hands-off approach. In the worst case scenario, this can have deadly consequences. In Louisiana, following Hurricane Ida in 2021, 15 people died when they were evacuated from their nursing home to a warehouse that was in compliance with the plan that met the letter of the law, but nevertheless failed to protect older adults. I want to circle back to that third shortcoming that I mentioned before, that our current approach to risk mitigation and resilience does not account for the layered risks of age on top of other vulnerabilities like income or health or mobility. The reality is that climate change is already contributing to changes in older adults' health and financial well-being in ways that differentiate them from other age groups, especially when you consider how they intersect with risk exposure. Let's focus first on financial well-being. I work in housing, and we all know that housing stability and affordability is absolutely fundamental to the health, well-being, and safety of everyone, so it calls for some special focus. Late last year, Harvard's Joint Center for Housing Studies reported that the number of older adults who are paying more than 30% of their income on housing, in other words, their housing cost burden, is now at a record high. This applies to both renters and homeowners. In 2021, 56% of older renter households were cost burdened, and 26% of older homeowners were. With this much pressure on housing costs, very little wiggle room remains for other expenses, including preparedness or recovering from disasters. Part of the reason that housing costs have increased as a share of income is because the cost of insurance and utilities are rising, driving the true cost of housing higher and making it more volatile than ever, which again poses additional risks for older adults on fixed incomes. Already many, yeah.
It would seem to be of note that insurance companies are bailing.
You're ahead of me.
Altogether.
I'm getting there. Hold on. Yeah, hold on back. Yeah. Already older adult-headed households struggle to afford utilities. A 2020 study reveals that 7 million older-headed households said that they had to forego food or medicine to pay for utilities bills. That means that someone who's suffering in a house or an apartment that's too cold or too warm is making real-time decisions about how much they can afford and how much discomfort they can withstand. Reports also show that high energy burdens are more likely to impact low-income households, where the median spend is 8% of annual income spent on utilities, compared to 3% for the average US household. These high energy burdens are also more likely to impact Black, Hispanic, and Native American households, as well as renters and residents of manufactured housing. Older adults are disproportionately represented among all of those groups. There are some public programs that exist to try and offset this problem. LIHEAP, don't make me say what it stands for. Heat Energy Assistance Program, blah, blah, blah. LIHEAP and weatherization programs aim to offset the cost of utilities for qualified households, but needs often exceed available funds, for example, and there's often little or no provision for increasing need to cool homes as temperatures rise, particularly in places that have historically only offered heating assistance, but now need cooling assistance as well as our temperatures change. In addition, it's well known that the cost of homeowners and hazard insurance premiums are increasing as we develop more data-informed projections about risk. Hazard and homeowners insurance companies are reducing their coverage and raising their prices, and in some cases, as this gentleman pointed out, leaving markets altogether, causing downward spirals in home valuations, which spells double trouble for the older adults who have all their savings tied up in retirement, their retirement savings tied up in their home equity, and yet they don't have sufficient disposable income to pay for those higher premiums. With new data-informed maps, FEMA is adjusting the cost of our national flood insurance premiums. The agency is phasing in those changes, but some of them mean that people will pay increases as much as 18% each year for more than a decade. That, in real terms, that means that a homeowner in Louisiana would see her flood insurance premiums go from $842 a year to $5,431. I mentioned that some subsidy programs exist to offset the cost of utilities, but to my knowledge, there's no program that solves this gap of insurance. As a result, older adults simply go without insurance or woefully underinsure themselves in their homes, adding to their risk and vulnerability in the face of climate disasters. But it isn't just in the form of higher utility and insurance bills that our climate-fueled conditions are impacting the well-being of older adults. Climate is taking a toll on older adults' health as well. Flooding and extreme heat are some of the most difficult aspects of this new climate normal for older adults to adapt to. Increased flooding can result in repeat inundation in homes that leads to black mold that in turn contributes to poor air quality, exacerbating respiratory challenges. But periods of prolonged heat are particularly deadly for older adults. Extreme heat is now the leading cause of weather-related deaths in the US, killing more than all other weather-related causes combined. Heat-related illnesses lead to 12,000 deaths each year, and of those, 80% are over 60. We saw this in stark relief in the Pacific Northwest, where 1,000 people died. In the most impacted county, where the largest number of people died, the average age was 68. That's because older bodies don't process excess heat in the same way as younger bodies do. For the 30% of older adults who live alone, they can be at greater risk when fatigue or weakness from heat exhaustion go untreated because they are missed, because they often mimic other health conditions. Extreme heat can prevent people from leaving their home to get groceries or medical care because it's simply too hot to go outside, especially for those who no longer drive and rely on walking or biking or public transit to meet their daily needs. Extreme heat also leads to droughts and wildfires, which in turn create even more complex conditions, where smoke from fires or toxic pollutants from dried up water bodies, as is the case of the Salt Lake City Basin, also exacerbate respiratory challenges and increase the odds of heart attack for people who are diabetic or overweight. And of course, extreme heat also requires the use of more air conditioning, which in turn drives up the cost of utilities, but it also means more demand on the electric grid that can lead to extended power outages in ways that can be particularly harmful for people and their caregivers who rely upon in-home medical equipment. When the grid becomes overloaded, blackouts are the result. Blackouts are, of course, inconvenient for everyone, but they represent a true hazard for older adults. And when they last for several days, weeks, or even months, as has been the case in Texas recently, and Louisiana and Puerto Rico in prior years, those risks multiply. Long-term power outages in Puerto Rico tragically showed how people of all ages are left without access to clean water, fresh food, and basic power. But it's among older adults, in particular, that a higher death toll results. That is in part because the lack of power is felt more acutely by people who, again, rely upon in-home medical equipment like oxygen machines or lifts. It's felt more acutely by older residents of upper floor apartments in multifamily buildings who, without backup power or an ability to take the stairs when the elevators stop working, become effectively trapped until the power comes back on. This very thing happened in New Orleans after Hurricane Ida in 2021, in which several such buildings were left without power for weeks. It ultimately led to the death of at least 8 older residents. The city in turn adopted new policies to require backup power in buildings where there's a concentration of older adults living. Another quiz. So it's a lot. I hope by now you're asking yourself the question, what can we do about it? I was at that point myself in 2022 when I started to dive into this topic, and it ultimately took the form of the book that you have now in front of you. Drawing on lessons learned throughout my career and even more learned during my year of research, I finally landed on 3 big takeaways that I think begin to lay a pathway towards solutions. First, we have to be clear-eyed in our understanding about how climate change is impacting older adults and accept that in many cases it impacts them more greatly. That has to start with more commitment to understanding who older adults are and what their needs are. I often ask people to imagine the difference in needs between a healthy, engaged, financially secure 62-year-old and an 89-year-old who lives alone in substandard housing, who deals with chronic medical challenges and has no savings. Or a grandparent who lives comfortably in an intergenerational home with her child and their family, compared to one who's caretaking for a spouse with dementia. Older adults are a varied group in ages and abilities, and more racially, ethnically, and linguistically diverse every year. Therefore, climate resilience plans have to be built on a foundation that seeks to understand how the financial, health, caregiving, connectedness, housing, and mobility needs of older adults intersect with their climate risks. Second, we need to recognize that individual and even institutional preparedness is not enough. One conclusion that I reached from my research is that these tragic lives lost aren't often the result of a failure of individuals to prepare. More often, they are the result of unrealistic expectations about what it means to be prepared for someone who lives on a fixed income, or who cares for a homebound family member, or who can't drive. They are also the result of systems-wide failures that impact the whole community, but especially older adults, and therefore must be done at the community scale. Third, These and other reasons are why we need to lean into community-wide resilience. I say the same thing to nearly every audience, which is that all sectors and all disciplines have a role to play here. Emergency managers, housing advocates, transportation planners, healthcare providers, utilities, and especially aging advocates. This is no longer a job for any one sector or profession, it's a job for all of us. Furthermore, I believe it is the job for all of us. After all, we all have older adults in our lives whom we love, and we all presumably hope to live in a community ourselves as we age where we will be safe and secure in the face of a changing climate. We are not on a path at the moment to create such communities, and therefore we must redouble our efforts to build community scale resilience. So what is it that I mean by community scale resilience? I'm going to briefly touch on these and then I'll go into more definition. It means thinking differently about our infrastructure, gray infrastructure, grid infrastructure, and our social infrastructure. It means thinking about resilient housing construction, especially in age-targeted housing, and creating a diverse transportation network, particularly for the 1 in 5 people over 65 who don't drive. And certainly it means much better communication than we currently have around disasters and leveraging the community-based connections that we have. Each of these present opportunities for you here in East Lansing to advance through your comprehensive plan, your age-friendly plan, your climate sustainability plan, or through all three. First, investing in climate resilience means certainly investing in more hard infrastructure. Things like seawalls and levees in some communities. It looks different everywhere, but hard infrastructure that will protect communities, as well as more thoughtful and well-maintained stormwater systems that better manage extreme events, while also delivering environmental outcomes. It means more green infrastructure, both on-site at the property scale and in the public sphere, places like libraries and parks, in order to better manage flooding and create more green space for community members. Certainly means more trees throughout a community to combat urban heat island effect, lower indoor air temperatures, and make it possible for older adults and people of all ages to safely navigate public spaces on increasingly hotter days. It also means investing in more renewable sources of energy and a more resilient grid that can withstand extreme conditions and keep the power on. Community scale investments like this can contribute to a better community rating score from FEMA that in turn lower flood insurance premiums for individuals. Community resilience certainly also includes more housing options, not just to respond to our current housing crisis, but also to respond to the climate risks and demographic shifts that we are observing. It calls for more intentional investment to create affordable, accessible, and green housing options. That can be accelerated by zoning codes that allow for smaller and more dense housing, again, like the condo development that was discussed before, by encouraging construction of accessory dwelling units, missing middle housing solutions, and more. You ultimately create greater choice for people in where they live and how they age, as well as cultivate a more organic social network amongst neighbors that can help in times of disaster. These efforts can be further enhanced by incentives and building code requirements that encourage greater use of green building standards like LEED or Energy Star that reduce energy and water use and foster indoor air quality that's better for people. With greater use of biophilic design to cool homes and requirements to better flood-proof homes, you can prevent sewer backups and recurring water infiltration. And finally, community resilience would certainly include a more intentional approach to utility planning. Gary and I were discussing that before, that accommodates rooftop and community solar to lower household costs and ensure a more stable source of energy. Community resilience would also deliver a diverse transportation network that includes public transit and fosters biking and walking to provide safe, affordable, and reliable options for non-drivers. That means robust public transit, bikeable and walkable communities that are safe for everyone. It would include streets and sidewalks that plan for accessibility with adequate seating and opportunities for rest, shading for transit stops, and well-maintained sidewalks for people who walk and roll. It also means more focus is applied to identifying appropriate vehicles for non-drivers and people with disabilities in times of disaster. That means that emergency vehicles and others that are used to transport people are to ensure that they're accessible and that they can handle the larger, heavier assistive devices that are becoming more common. It would also include shared use agreements that would allow sharing amongst entities, things like buses and vans, in ways that are pre-negotiated and predetermined so that you can leverage all of the assets in the community. And it would require that human service transportation plans, which are plans that are funded by Department of Transportation to pay for paratransit, take into account disasters. That is not necessarily a requirement from the federal government. Some states do require it, but not all do. Finally, community resilience would include multiple modes of communicating about disasters, keeping in mind the significant share of older adults who aren't internet savvy, or who live with disabilities, or who speak a language other than English. It means bolstering the ability of grassroots groups to support residents with person-to-person support and resilience hubs in walking distance of homes, like the one illustrated here in the community lighthouse model in New Orleans that I talked about in the book. In this case, a local community-based organization called Together New Orleans is working to create a series of resilience hubs throughout the community, largely based in churches and other community-facing buildings. That includes renewable energy, basic power, food and water, but it's also coupled with a volunteer effort that goes out and knocks on the door of every person in that service area to make sure that they are known to the lighthouse staff and that their needs can be accommodated before the disaster strikes. Many partners, some of whom are new and unconventional, are needed to achieve this community resilience. Utilities, for example, can implement payment systems that lower the seasonal cost spikes that cause many older adults to go without cooling or heating. They can encourage greater energy efficiency in homes and more renewable energy and battery storage to provide power when the grid goes down. Healthcare professionals can proactively address the issue of climate change in the course of medical care, so that older adults and their caregivers better understand the risks of longer, hotter seasons or poor air quality days, especially as they relate to underlying medical conditions. And home health aides can be better trained to help their clients prepare for climate-related disasters and risks, and identify interventions in the home that can make them safer, like air purifiers or backup power generators. Emergency managers and climate resilience planners can more explicitly incorporate aging in their planning, and not just for older adults who live in those congregate facilities, as tends to be the case. They can plug into ongoing age-friendly efforts like the ones here in East Lansing, and serve as a resource and as leaders to advocate for more risk-informed housing, transportation, and infrastructure solutions. And aging advocates can recognize that climate change is central to their work. They can educate and train their industry, integrate climate considerations more routinely into the programs and services that they offer, and they can make themselves known to other sectors as experts, both as a way of establishing relationships that cultivate a greater understanding of older adults and a greater consideration for them. When these and other disciplines center their work around how to reduce climate change risks for older adults, we create safer and more resilient places for all. So I want to end on a positive note. Just a few months ago, a historic vote came down from Europe's top human rights court, and this represents a potential sea change in how governments act with regards to climate change, and it is rooted in the needs of older adults. The decision was the result of a court case brought by a group of women, Swiss women, all age 65 or older, called Klimasenioren. They argued that their government had failed to take adequate action to protect them from the risks of climate change, particularly extreme heat, and that violated their human rights.
Huh.
Yeah, they were victorious. The court case cannot be appealed, and it will have ripple effects throughout Europe and potentially the world in due time. Their success gives me hope, because when we work to solve for the needs of older adults, we also solve for the needs of people on limited incomes, or who can't drive, or who live with disabilities. We solve for those who are often overlooked and not heard because they are isolated either by choice or circumstance. We also serve the needs of our future selves by creating systems community-wide that better account for our changing abilities, needs, and risks as we age. And with that, I want to say thank you so much for the time and your attention. Questions? Yeah. Hit me. I quiz you. No, you get to quiz me. Yeah.
I'd like to give a shout out for your call for more green infrastructure and for resilient energy. I'm a 50-year plus resident of East Lansing, and I think we come up way short in both of those categories. So that basically,
with ya.
I don't want to veer off into negative, but
No.
I do want to shout out on your call for more green infrastructure and for more resilient energy. We've been through almost countless blackouts here,
Mhm.
some of them up to 10 days.
Oh my gosh. Yeah, I agree. I mean, what I've learned is that a lot of the solutions that can be brought to bear don't only serve the needs of older adults, but when you start to identify the challenge of how do you make a community safer for older adults, you get to solutions that benefit a lot of people, including things like green infrastructure and resilient grids and renewable energy sources. So everybody can benefit from it, but if you are as a community focused on trying to reduce risk for older adults, it's gonna naturally lead you to that solution among many.
We're a fairly prosperous community, and I think our problems reach far wider.
Yeah.
My question, I'm thinking, yes, all these things are very positive, and I'm thinking, we have a very, I think, affluent community. And I'm not sure, so, anyway, where are we going to get the money to start actually doing this? Will the people, the homeowners, really support this movement? And how do we get the general population to buy into it, to actually say, okay, it's gonna cost $1,000 more per unit, per taxpayer?
Yeah.
How do we positively motivate people, because in a lot of people are worried about their income and what they're spending on. How do we get them to willingly say, yes, it's better for our community? How do we get there?
So I think it's two separate questions. How do we build the political will, and where's the money coming from?
Yes.
So on the political will question, after working at well, back up even further. I'm a planner, land use planner. I've done that work all my life and have done similar kind of work, but it's often been called different things. We called it smart growth at one point. We called it sustainable communities at another time. We call it resilience. We call it age-friendly communities. Often it's all the same solutions. The one that has the most potency, I think, honestly, is the age-friendly frame, because it is the most inclusive. We are all aging. We all see ourselves as benefiting from an age-friendly strategy, maybe not now, maybe in 10 years, maybe in 50 years, but it is the most inclusive frame of all. I think that when you put a challenge before your community to say, how can we become a more age-friendly place, and how do we weigh that against the risk of climate change, I think that's a way to build political will. And I do think it starts with committing to being the place that's gonna allow people of all ages to thrive, but really asking the question, with each decision, how can we reduce risk for older adults with this investment, with this policy, because that's gonna get you to policies that serve other people better. The other question on the financing, it's not like a silver bullet, it's not gonna solve everything. The other question on the financing is that right now with the Inflation Reduction Act that was passed 2 years ago, there are more resources than ever before to invest in things like renewable energy and community resilience and energy efficiency. There are so many programs that are both being implemented by the federal government and through state energy offices and state housing finance agencies to support this kind of change in our infrastructure and in our housing, that it's kind of a golden era for those folks. Again, it's not going to pay for 100% of everything, but it sweetens the pie a little bit for people who might be thinking about investing in rooftop solar or investing in an all-electric heat pump instead of a gas-fueled furnace, for example. Another question? Oh, yeah.
What is the role of the private sector in this, in partnering with the rest of us?
Yeah, lots.
Could you repeat?
The role of the private sector. What is the role of the private sector? So I'll start with the biggie, utilities. Utilities are, they have a massive role to play, I think, both in terms of thinking about how do they design their rate structure in ways that make it easier for older adults to not have to make those trade-offs. How can they encourage renewable energy, in their own service areas? So that's one clear thing that utilities can do. Healthcare, as a private entity, has a big role to play here as well. I think it does people a disservice. I think it does patients a disservice when doctors are not confronting climate change as part of the course of medical care and making it an explicit conversation about how increased rainfall and maybe that leads to flooding in the basement, which might lead to poor, indoor air quality or mold inside the home, or whether more hot days and extreme heat intersects with some of the health conditions that people are already living with. And I think that industry as a whole can do better and more around, confronting climate change and making that part of medical care. And then when I think about like housing developers and, people who go out and build market rate housing, you could always make a home more accessible. You can always decide to put 0 steps or fewer steps rather than a tall driveway, a tall set of steps into the front door. That's not gonna affect the price, might bring down the price, might make it more viable for more people. So I think there are small, and that's just on accessibility, that's not to say anything about energy efficiency or climate resilience. So there are a lot of different, I think, decision points that all people can make, whether they're private sector or public sector. And I really do think it starts with like asking the question, like, what is the change that I can make in this decision that's going to reduce risks for older adults in the face of climate change? If you're consistently asking and answering that question, I think it gets you to better outcomes. Yeah.
I'm curious about the transportation in the event of evacuations.
Mm-hmm.
I mean, we typically, when we think about that,
Yeah.
in our community, we have CATA, which is our transportation system.
Okay.
You're from DC,
Yeah.
I guess you wouldn't know about it. But for our paratransit, we have, it's called SpecTran,
Okay.
which is wheelchair access.
Okay.
And I'm wondering if our CATA, does anybody know, does our CATA system have an emergency plan for evacuations to help these people?
It's not, well, I'll tell you this, when I was doing the research, it sounds like the Spectra is the one.
SpecTran, yeah.
SpecTran is the one that's funded by this $5310, the DOT program that funds paratransit. They do not have a requirement that they plan for disasters. Some states have interfered and said, hold on, if you're getting federal dollars, we want to make sure that we see your plan for disasters and make sure that you have a plan for bringing paratransit resources to disaster and evacuation. Not all states do. So it's a good question to ask your Michigan DOT.
So it sounds like what we have to do as individuals is get involved into our local community governmental offices and
Yeah.
speak out and speak for and get something that's moving.
Absolutely.
At the ground level, at the individual level, we work together to get these changes put into action.
Yeah, absolutely.
Because if we wait for them, we're gonna be waiting for a long time
Yeah.
until they start aging.
Exactly, that's exactly right. I think people deal with the problem immediately in front of them, and they don't necessarily think about the problem that's 10 or 15 or 20 years down the road. Yeah.
And I would be curious on the, with the SpecTran, historically, at least as of about a year ago, E-Tran would cross county lines for medical appointments, SATA board. So there was some precedence for crossing in certain situations
good.
that were medical.
But you can't assume that's in case.
Correct.
Yeah,
And
yeah.
and I guess I've always worked for people that are Medicare, Medicaid, so, and healthcare, so we've always had preparedness. But I didn't realize it wasn't required in other
Yeah.
areas. That was eye-opening for me.
What do you see as the role of city government?
The role of city government is huge. I mean, I think the city government is the place where housing policy gets set, it's the place where transportation decisions get set, it's where land use decisions get set. All of those things influence the community's resilience. So if you're zoning for huge new housing developments out on the edge of a city that require everyone to drive, you're not accommodating the needs of people who, when they reach a certain age or maybe don't have the finances where they can't drive. You're not planning for a resilient future that allows for redundancy in different transportation options. You're also really making the price point for those houses a lot higher because they're all developed as single-family detached homes out on the urban fringe. I give that as just one example of the role of city government. On the flip side, that same city government could say, we want to encourage more dense housing, smaller housing, more connected housing. We want to encourage the transportation options that respond to the needs of people who live in those homes, who maybe can't drive or can't afford to drive or who choose not to drive or never were able to drive because of a disability. So the role of the city government is huge in this, and I think it starts with things like the comprehensive plan and the consolidated plan that lay that vision out and say who is it we want to try and be and how we're going to direct our public dollars to get there.
So, just a follow-up question. I think a lot of folks that are aging would like to age in the home they're can,
Yeah.
not necessarily have to move to a condo
Right.
or some consolidated housing of
Yeah.
some type. So
So what are the
you're
options?
focused, or kind of focused on housing changes that people may not want
Mhm.
versus should we be more focused on transportation alternatives?
It's not one or the other, they go together, and I would say that because, for example, the housing changes. A lot of communities around the country have, and I don't know if this is in place here, that permit accessory dwelling units, where you can actually build a second unit on your property. It can be a separate house, it can be an attached house, it can be a basement conversion. What that does is it gives people choice in the size of home that they choose to live in. So for example, imagine here, you know, someone lives in a neighborhood they love their neighbors, but they live in a 4-bedroom house because they raised a family. Their kids are now flown the coop, they don't need the big house, they don't necessarily wanna take care of the big house or pay for the utility bills. Their only options are move into a condo or move into a nursing home. A policy like accessory dwelling units that would allow someone to build a smaller home on their property would allow for that person to move into a smaller home on their same property and rent out their main home in ways that keep that neighborhood connection that people really value. A lot of communities say that's illegal. You can't do it. A lot of communities though have seen that that's part of how we create housing options for people without radically disrupting what our community looks like, and allows for change to happen incrementally. When you start to see neighborhoods that have more ADUs, accessory dwelling units, then you start to see maybe more people who are gonna benefit or who would use public transit. So if you have more people in the sort of shed, the area that's gonna be served by public transit, you have greater demand for services, which means you have better service, which means you have a better public transit system for people who use it. So they all kind of go hand in hand. You can't do one and not the other. But housing changes don't mean radically changing the way East Lansing looks. It can mean these incremental kind of zoning changes that give people more choice. Yeah.
Are you familiar with the Duane development in Middleton, Wisconsin?
I know of Andres Duane. Yeah, I don't know that one specifically.
Okay.
Like new urbanist developments.
The idea is it's sort of a more old-fashioned
Yep.
model with apartments above buildings and alleys and
Yeah.
curvy streets and so on.
Yeah.
And it allows real economic integration.
Exactly.
And fluidity with being in the same community.
Exactly.
It's pretty.
It is. So yeah, what they call it, new urbanist. That's kind of that style of development, new urbanist or smart growth. Like it's really about creating more housing options than most communities do right now. Right now, many communities say you have to build at least a 1,600 square foot house, has to be on at least a half-acre parcel. You know, those kinds of rules that set the baseline that make it really hard for people to find housing, frankly. When you kind of loosen some of those restrictions and you create an opportunity to create different neighborhoods, whether that, you know, sort of more dense development is in the city center, but you still provide options for people wherever they live to add a second unit on their home or next to their home, you again start to create more housing solutions that really just give people choice.
My daughter lives in California.
Uh-huh.
In Palo Alto, they do a lot of that.
Yes, California has changed their policy and now they allow for ADUs by right. So you don't have to ask the neighbors if it's okay to build, you can build it by right. They've seen a real boom. People can do it fairly quickly and relatively affordably because you can prefab a lot of this stuff. So there's some really beautiful housing design. I'll say my ex-husband, honestly, he built the most beautiful ADU in his backyard, and my daughter is gonna move into it in January. Like, it's amazing, it's gorgeous. Yeah, and he could do it by right. It is picture perfect. And his plan, he's my age, he's 55, he's gonna move into it when he doesn't need the big house anymore. He's gonna move into the ADU in the backyard that he's designed for his own need. But in the meantime, my daughter is gonna live there. Yeah, and he's been earning $1,900 a month rent for the last year and a half. So ADUs are a pretty good solution. Yeah, in the back.
You talked a lot about the responsibility of governments and other organizations. Can you talk about the responsibilities of the individual?
Yeah.
And
Could you
also,
repeat?
are there resources that, let's say, city government can use to help educate individuals on what they can do?
Definitely. So the question was, I talked a lot about the responsibility of the public sector. What about the role of the individual? And what are the resources that local government can provide? Yes, I don't mean to suggest at all that people have no role in preparing for disasters or climate change. They do. But what I try to caution people about is not having unrealistic expectations of what preparedness looks like. Think about someone, if you're asked to, you know, stockpile food and water for 2 weeks, but you're frail. You literally can't lift a 5-gallon thing of water that you're supposed to, stack up in your basement or your mudroom or whatever. Or you just don't have the money to go out and buy 2 weeks of groceries or prescription drugs. Or frankly, you are responsible for caring for someone who has dementia. And therefore, if you were asked to evacuate, sure, you could drive yourself, but how do you then manage the challenges of the person who you are caring for? All of those reasons and many more are why preparedness definitely has to be part of it, but I think we just have to have a little bit more of a realistic view of what it means for some people in terms of preparedness. In terms of your question on what the local governments can do, there is several things. One, I think I know a lot of communities have implemented something called the Special Needs Registry that allows people to kind of self-nominate themselves for a list of special considerations. So they'll call up the fire department or the police chief or the city office and say, I want to get on the special needs registry, I'm blind, or I have an oxygen machine, or I don't drive, or my daughter lives 2,000 miles away, there's no one else here to check on me. I just want to be on that list. I want to be on your radar screen. So that's something that a city can do to establish a list like that.
Can I follow up and say, even, we have our age-friendly community.
Yeah.
What can all ages do to prepare and work on, in their individual households, their yards, to prepare for climate change, planting natives, planting wood, I guess I'm looking at not just in a disaster.
Yeah.
How can we just, slowly work on our own backyards
and the most fundamental thing, honestly, is build up that social resilience, build up that community connection, knowing your neighbor, being able to understand who they are, what their needs are. And everybody can do that right now. If you've never met, you haven't talked to your neighbor in a while, go knock on the door, reacquaint yourself, get to know them, swap cell phone numbers, etc. That's one thing. But then there's this broader, I think, opportunity to just think about how we prepare for climate change, meaning how are we trying to mitigate the effects of it? How can we lower our utility usage? How can we lower our water usage? What are the things that we can do to make a small little dent in the emissions that are happening? Because when you do that, you're also probably finding ways to make yourself a little bit more resilient. So if that means that you think about installing renewable, solar panels on your roof, that's going to both bring down the cost of your utilities. It's also going to mean that you're not another user of the grid in times of a blackout. You have the power, if you've got storage, particularly during the blackout, but you're also providing a source of energy for your community as a whole. So it's an action that you can take at the household level that does contribute to broader community resilience. Flooding too, I think flooding is a really big thing. Like I'm always mindful of, water infiltration in basements and the degree to which some of those fixes are actually quite simple. If you think about where the downspouts are going, are they actually going away from the house? If you're an older adult and you're not out there doing yard work that much, or maybe you just don't have the ability to kind of think about or make those changes, like what are the small changes that as a community we can make for older adults to make their housing safer, more resilient, in ways that not just benefit the resident now, but also start to kind of convert the housing stock over time as a whole. Making homes more energy efficient is a huge opportunity. Just figuring out where the leaks are, how do you get more out of your utility dollars by keeping the heat and cool in the house. And that is another role where I think city governments can play a role, is encouraging energy efficiency, encouraging, access to some of these rebates right now that make it cheaper to switch from, gas-powered furnaces to electric furnaces and the like. Plus things like native plantings and all of that. Yeah.
You've given me encouragement in terms of something that's been gnawing at me for a while, that I think a lot of people are being impacted by, is the Board of Water and Light is proposing a rate increase. I think it's 18%.
Yeah.
Now, for some people that may not seem like a lot, but it doesn't stop there.
No.
It's gonna keep going.
Yeah.
So the encouragement you gave me was, I need to talk to my neighbors.
Mm-hmm.
Are they aware of this rate increase?
Yeah.
What can we do about it?
Absolutely.
I know that there's the information about
not using, utilities between the hours of 1 and 8 o'clock,
Uh-huh.
which we try to abide by as much as we can. So talking to other people, I agree with you, that's the way to go.
Yeah, and I think utility costs are a really interesting thing, because even when you talk about people and you ask them how much they pay for housing, their rent or their mortgage, they don't mention their utility costs. But utility costs are such a big part now of the cost of the true cost of housing. But it's, even when you go to look for a place, if you're looking for a mortgage, your lender's not asking you how much utility costs you're gonna have to pay. It's not even being factored into what housing costs truly are. So, yes, I agree. Making utility costs more central to the discussion around how much people can afford as it relates to their housing cost burden, and making sure that you are activating people to get out in front of the board, the PSC and the Public Utilities Commission and others, to say, we need more support from our utilities. Maybe we need different payment plans, or we need different incentives, or we need a different payment structure that's gonna allow it to be not quite the utility cost burden that it is now for many homes. Yeah.
Or just have public utilities that are part of the democratic process, where you don't have that layer
Yeah.
of bureaucracy and self-serving
Yes.
stuff that goes on with utilities.
Yes, that's
So
true.
you're saying it could be
A co-op, like more of utilities co-op, kind of like a public entity rather
Actually-
than a private one, yeah.
Historically, in Wisconsin, where I used to live, there were very Republican areas with old-fashioned city fathers
Okay.
who didn't want to pay more than they had to for their business utilities. And said, it's in the interest of the whole community to have this town, village, whatever, own the utility, and only have the costs that don't include all of the business overhead and profit taking.
It's a pretty opaque process in many cases. I mean, we have someone here who worked for the commission for many, sorry to out you in the front row here, but to lean on resources like that to help understand what the utility situation, I don't know the specifics of Michigan, obviously, but yeah, utilities are a big player here, and I think there's a lot of education and awareness.
East Lansing does get its power and its water from a public
Okay.
utility.
Okay, that's good. So there's an open process where
But each community is different.
Each community is different.
Yeah, I was in one recently, but they wouldn't even set up a payment plan for somebody who was, on hospice care
Isn't that
or
crazy?
dependent on oxygen with pulmonary disease.
I mean, isn't that like, that seems so inhuman?
Yeah, everybody's,
Yeah.
each community is different.
Yeah.
I was just wondering, are there other aging societies that are doing interesting, inventive things that we should be paying attention to, like Japan or China even?
For sure. So that's like the next book I want to write. It's the global one. Yeah, Japan, a third of their population is already older adults. And so they have really, as much as I know, which is not much, have already really begun to think about this issue, particularly around resilience and disaster response and preparedness. They do involve, frankly, part of the solution is engaging older adults more as kind of resilience ambassadors. So they are both leaders in the field and beneficiaries of that work. I don't know too many of the details, unfortunately. I would say here in the US, I talk about a couple of case studies in the book. One of them being Portland, Oregon. Everybody loves or hates to hear about Portland, but probably more hates to hear about it. But one of the things that they did, I think that was really effective, was they responded to the heat waves that they had in 2021, in which so many older adults died, and they said, we gotta do different next time, and they ended up utilizing a network of community-based organizations that had helped deliver food and prescriptions and other amenities, necessities rather, during COVID, and they kind of repurposed that network to get the word out about electric heat pumps, portable air conditioners. So, they found funding, and they prioritized older adults who are low income, who have disabilities, or 2 of the 3 of those conditions, and use those networks to get the word out so that they could deploy really quickly portable air conditioners into the homes of people who needed it. So there are great examples like that from around the country, some of which I talked about in the book. Yeah.
I'm thinking our age-friendly community steering committee has a big role to play here, and Landon, I know we talked about alternative dwelling units, and I know the city has talked about that, and I know we're working on the comprehensive plan, but can you address some of the forward-thinking ideas the city has right now that we might see as solutions and resilient?
Thanks, if I can step in. So, first off, I just want to recognize Danielle Arigoni again. I think it was an amazing. Lori, your point about the age-friendly communities committee, I should say we have a committee, that's one thing, that puts us ahead of some communities. The Seniors Commission has a community or a committee that created the age-friendly communities work plan for East Lansing in 2020, and now they're charged, they were reestablished in January by the City Council with the express charge of taking a look at that work plan and making sure it's up to date. And so the next meeting, I think, is September 19th, and that committee has been meeting bi-monthly, and right now their homework until the next meeting is to go through that previous work plan and try to understand what's worked, what hasn't, what's changed in the last few years since it was adopted in 2020, and how should we change it. And that's going along at a parallel track to the comprehensive plan update. This event and several others is part of the comprehensive plan update. Our comprehensive plan was last adopted in 2018, and late last year, the Planning Commission said, yes, according to state law, we have to check out our comprehensive plan and determine should we update this or redo it completely or just let it sit, and they said, let's go update it. So we did some community engagement last year that said, what should we focus on? The focus areas that came to the forefront were social equity above all else, basically saying, how do we make sure to right historical wrongs that have maybe made the playing field uneven. Beyond that, sort of through that lens, the major focus areas are climate resilience and housing and public health. And so, especially with Danielle's discussion about climate change and housing and for an aging America, right? This is pretty timely. As far as like actual tools and sort of what is East Lansing going to do? There's a lot that's going on right now. I would say that determining whether or not we need to change what we're doing and how to approach some of these goals is going to be the next step after the comprehensive plan update. Because right now we're trying to determine, okay, where have we been and where do we want to go? Where do we need to go? The next step after the comprehensive plan update is adopted, although I would say it never quite ends, but the next step is to change our ordinances. And so we'll start looking at that and saying, okay, we've identified what we want to do or how we want to, where we want to go, and now we need to figure out how we're going to get there. And typically a tool is the zoning ordinance.
Can I say one thing? As you're doing that work, I really encourage you to check out the Livable Communities Program at AARP. It's aarp.org/livable. They have so many great publications, one of which is it's just about accessory dwelling units. It shows great visuals of how these can look in communities, how they fit in different contexts. Another one more recently is on missing middle housing. I see, oh no, sorry, I thought I saw the AARP booklet here. How to make housing more accessible. So tons of resources, they're all free, they can all be downloaded. Please use that as a library as you do your age-friendly work.
I would like to also plug that the East Lansing Senior Commission, in coordination with Age-Friendly Community, in coordination with the Senior Prime Time, is going to have a survey coming out in September, and I would encourage everyone who is age 50 and older to fill that out, because we are reaching out to the community to ask them what their needs and wants are, what's working, what's not, and that's another thing we would look at the age-friendly community.
Awesome, that's great.
Nice plug for that.
And if I can just mention the question about ADUs and should we have these? So East Lansing Code currently allows ADUs in one place, and that's a neo-traditional neighborhood redevelopment overlay district, essentially. So we have one of these locations in the city, and that's for Avondale Square over on Lexington Avenue by Hagedorn and Burcham. But no one has taken advantage of the ability to construct an ADU in that district yet. So we've certainly, one thing that we've been seeing from a lot of these meetings has been people saying, hey, we should have ADUs. And we go, great, we do, but we need to have them in more places. So along the question too about individual versus city council or public action, the city listens to people, right? Listens to constituents. Typically, elected officials are responsive to their constituents, right? So you have a significant amount of influence, being that you can tell your city council members, we really need this. City isn't that proactive typically, but much more responsive, right? Planning tends to be a little more proactive, but we're just going, hey, we see that down the road, we should do something about it. But it really takes public support of the city council to sort of make the things happen. With that, I want to take a little bit of time for a break. We have at 1 o'clock, which is in about 6 or 7 minutes, a listening session, which is gonna be right in this room. We're still gonna have the author being able to stick around a little bit, so we can sort of continue that Q&A. But it's really meant as a listening session for you to sort of reflect on what we learned today, what we've been talking about, and make sure that we understand your concerns and needs. So please take a little break.